revisit it. Perfect timing. So thank you all for joining us to overview the bills introduced that are going to impact gender equity. If you've been following the legislature at all, you know that I think scientists refer to it as a hot mess. And the tenor of the legislature is not great. So I am very excited, and we at the Women's Fund are very excited, despite all the nonsense happening at the legislature, to be working in partnership with so many amazing folks and organizations to help Nebraskans. So we have our partners in advocacy as it relates to economic security and access to reproductive health care and reproductive justice joining us on the call today. A note before we get into it about our discussion around abortion and reproductive health legislation. At the Women's Fund, we trust people to make decisions around their own lives and specifically their reproductive health care. Abortion can be an emotionally charged topic for many reasons. However, the Women's Fund is rooted in a value of bodily autonomy, meaning it is not our place to make decisions for someone else when it comes to their bodies and their health. So this conversation today, when we get to the abortion portion, will be rooted in these values. And I want to be very clear that if you came to debate abortion access or people's ability to seek the healthcare that they need, this is very likely not the space for you. Actually, it's absolutely not the space for you. And questions that are rooted in opposition to these stated values will not be elevated to the group. So just a brief overview of what we're going to do today. We're going to start with economic security. We're going to move to freedom from violence legislation and then into reproductive. Spend the bulk of our time at the end talking about reproductive health care as well as other issues that are impacting gender equity in this legislative session. So before I move the meeting forward, I want to let everybody, all of our panelists introduce themselves, and I'm going to let Katie Pitts start.
Hi, everyone. Glad to be here today. My name is Katie Pitts. I use she, her pronouns. I am the state policy director at Nebraska Appleseed.
Muted. And then we'll move on to Scout.
Hi, thanks everyone. I'm Scout Richter, she, her pronouns. I'm Senior Legal and Policy Counsel at the ACLU of Nebraska.
Thanks, Scout. And then Adele.
Hi, I'm Adele Burke. I use she, her pronouns, and I'm the Senior Manager of Public Affairs with Planned Parenthood North Central States based in Lincoln.
Fantastic. See, this is going to be a great panel. What a way to end our Friday in the 12 days of the Nebraska legislature that we've been through so far. So we're going to jump right into economic security. And I'm going to start off with some of our bills that we're watching. Actually, that's not what I'm going to do. I apologize. I'm going to hand it over to the expert in the field, Katie Pitts, to talk about these bills.
Yeah, we have a lot of great economic security bills and a few not so great economic security bills that we wanted to flag for all of you. The first one, LB 35, and I'll talk about LB 35 and LB 84 together, the bills introduced by Senator DeBoer and Senator Day. Both are kind of continuations of efforts that happened in 2021 when we passed eligibility increases for both our child care subsidy program and our SNAP program. So when those two bills passed in 2021, they had sunsets on them to end in September of this year. So LB 35 by Senator DeBoer is a bill that would extend the childcare subsidy eligibility level for another 3 years. And LB 84 would eliminate the sunset and keep the elevated SNAP eligibility level as it is in perpetuity. We think that both of these bills are timely given the fact that our economy is still dealing with inflation and people are still struggling, especially with food prices. We don't want to go back to the eligibility levels that either of those programs were at before 2021. Both were very, very low eligibility. And SNAP in particular has helped well over 4,000 families over the last year and a half access supports to feed themselves and their families. So it's been very successful so far. It's helped a lot of folks. So we want to make sure that those two programs stay at those higher eligibility levels so people who really need them can access them. LB 57 by Senator Michaela Cavanaugh is a bill that addresses paid family medical leave. We do not have any kind of paid family or medical leave requirement in the state. It's becoming more popular of a movement across the country of states that are requiring that paid family and medical leave be afforded to employees. It's a bill that she's brought before that just would grant a certain amount of time for both paid leave if you need to take it for family issues, if you have a child or need to take care of a dependent, and then medical leave for any kind of extended medical issue that you might be facing. So it's something that Nebraska very much needs. And the hearing actually on that bill is scheduled for Monday, January 30th. It should be in the morning. That day is a little bit chaotic in terms of how those hearings in business and labor were scheduled, but that bill does have a hearing set on the 30th. LB 58, introduced by John Cavanaugh, is a bill that also seems very important to provide tax exemptions for diapers. We need people to be able to access diapers when they need diapers and not have to pay any kind of additional tax on that. It's a necessity. It's something that families need to access, and let's make them, let's not put any barriers that are unnecessary in place of getting diapers. So that hearing is set for next week, January 26th, which I believe is a Thursday, in the Revenue Committee, and that hearing will be in the afternoon, sometime after 1:30. And then this TANF package, we're really excited about our TANF program. It's also known as kind of traditional cash welfare. In Nebraska, we call this program the Aid to Dependent Children program. It's for folks with children who need some extra supports. And we have 3 bills that we really think will go a long way to improving the program, because right now it is not proving very effective for people who are on it for several reasons. So LB 233 is a bill introduced by John Cavanaugh, which is a new kind of issue that we're looking at in Nebraska, because right now, if you're on this Aid to Dependent Children program and you are receiving child support, that child support does not go to you. It goes to the state. It's a practice that occurs across the country. And there's a nationwide movement amongst advocacy groups to really look at that practice, because it's very harmful for families who are on our Aid to Dependent Children program. In fact, people who are on, even if they were on the program and then got off the program, if there's any kind of debt owed by their child support, then the state continues to collect that until that debt is repaid. So you could be off of ADC and still having your child support collected by the state from when you were on ADC. So it's a really harmful practice. It doesn't help anybody. There's been states and cities that have looked into reforms around this practice, and they found, to no surprise, that when when non-custodial parents pay child support and it goes to their kids, and they know that, they're more likely to pay it than knowing it doesn't go to their kids. They don't really see the point of paying if it's not going to their children. So they've found all kinds of great impacts when they reform this issue and make sure that child support gets to the families and gets to the kids that need it most. The other 2 bills change the program eligibility levels and change the program's payment levels. So LB 290, introduced by Michaela Cavanaugh, would increase the eligibility level for our ADC program. It is so low right now. We've actually cut in half over the last couple of years the number of families served by that program. We used to hover around the 10 to 12,000 families a year range. We're now under 6,000 families being served by that program because the eligibility level is so low. And so this would raise that eligibility level and make sure more families who would need access to the program can get it. And then LB 310, introduced by Senator Daniel Conrad, would raise the payment level for folks' benefits on that program. So they would see an increase in how much per month they're receiving on ADC. So 3 really great bills, really needed. We have money to do that too. There is a TANF rainy day fund of $130 million the state's just kind of sitting on right now. So we want to find a way to spend that money in a really effective way. And we think giving resources to people who need it most is the best use of that money. So that's what some of these bills would do. 2 bills I want to flag that we're not so stoked about are LB 15 and LB 327. You may have remembered on the November ballot, we voted to increase the state's minimum wage, which is really exciting, very needed. It would kind of stair step the minimum wage to eventually reach $15 an hour for every worker in Nebraska. These 2 bills, however, kind of go after that ballot initiative of change. LB 15 by Senator Breezy would create a youth minimum wage and a trainee minimum wage capped at $10.50 an hour maximum. So it couldn't go above that. We think that this is particularly harmful for a number of reasons, but especially because we've talked to a lot of young people who get jobs to help support their families or get jobs to help pay for the things that they need so that their families don't have to worry about them. And so we think that they deserve to be, I mean, everyone deserves to be paid just as much as everybody else. So there's no reason really why a youth minimum wage makes a lot of sense. What LB 327 does by Senator Raybould is that it limits the increase that was also included in the ballot initiative that would raise the minimum wage based on the consumer price index. So as the standard of need goes up across the country each year, you would see an incremental increase in the minimum wage too. This bill would essentially do away with that. It makes it so that it's either a 1.5% increase or the CPI increase, whichever is less. So we would often always kind of assume that it would just be a 1.5% increase, which is very, very minimal, especially as we see inflation and other kinds of cost of living costs go up so dramatically. So Appleseed, and I know others are opposed to both of those bills. We will be working to try and stop those bills from moving forward because we think they really go against the will of the voters. So we wanted to flag those for you all too. And I think that's all. So Erin, I'll let you pass it on to the next person.
The next person's me. So thank you. Yeah, and we'll have a much fuller list of economic security bills, but we wanted to make sure we flagged those for you specifically. But follow Nebraska Appleseed and follow our Be an Advocate page as well, and we'll have a much fuller list posted and update them with hearing schedules and how best to participate in the way that feels best for you. So moving on to freedom from violence, this is another portion of the Women's Fund's work. It's incredibly important, and it is very typically a bipartisan issue. Everybody wants to help in this space, which is nice. So a couple bills that we wanted to put out there for you, LB 11, LB 183 and LB 315 are all being led currently by the Women's Fund. LB 11 by Senator Carol Blood is basically says that when you file for a protection order on that application, there will include a line that says your pets can also be covered, your household pets, not your whole livestock herd or anything like that, your household pets will be covered as well under that protection order. And we think this is critically important because we do know that most of the data shows that people that being worried or not being able to take your household pet is one reason that people may decide not to leave an abusive situation. Additionally, we know that there's a Venn diagram, there's an overlap between domestic abusers and those who would also hurt animals. So It's a great bill. It's an easy bill. Makes a lot of sense. I said easy. It's never easy. None of this stuff is ever easy, but it's a good, simple bill that will do a lot of good for folks. LB 183 just is a little bit of a cleanup bill, honestly. Currently, if you are, let's say, a survivor who is looking to change their name for safety, your application for a name change is not, you can't waive the fees if you are low income in the way that you can in any other civil action. So for our freedom from violence work, this is critically important. Another very easy change, just making it uniform across statutes. LB 315 has a hearing next Wednesday, January 20, whatever that Wednesday is, blanking currently. Oh, right there, January 25th in judiciary, as well as 183. And this would just make it very clear that medical providers cannot send victims to debt collection for medical services received as a result of their abuse. We already have systems in place that should prevent this. It remains a problem, and we do not believe that victims should be further traumatized or be swayed from seeking the care that they need because they're concerned about ruining their credit or being able to pay for healthcare. Adele, your cat has entered the chat. It's very pretty. Speaking of household pets, supportive. Just a couple other ones to flag. LB 739, we're anticipating a cut in federal funding for DV programs. This would fill that gap. LB 757 would change requirements around applying for the Crime Victims Reparation Fund, which is the fund that should be paying for those medical services, mental health services for victims. LB 758 was actually written by a survivor and who had an experience that she is attempting to make sure never happens to anybody else again, and has drafted legislation and is moving forward with justice, and we love it. We love to see it. LB 759 would just, because we have had trouble extending the amount of time that protection orders are valid, so that the sorry, I just saw Cindy Maxwell. I should not be paying attention to the chat. Right now, we have been trying to extend the time before you need to renew a protection order because it is too short. It takes a little bit of effort. People can miss that deadline, and we want people to be safe. So this would automatically send out notifications to folks who have a protection order, reminding them of their renewal. We do this for gun registrations, so it seems like maybe we should do this for protection orders as well. I also wanted to, in opposition, we are taking a stance on LB 77, which is from Brewer. This is his permitless concealed carry bill that he had to do a poll motion on last session. And we will be taking a stance. It's critically important for us in our freedom from violence work in opposition, because we know that the presence of a gun in a domestic violence situation increases the risk of homicide by 500%. And it's just not good for Nebraska. It's not good for survivors. So we'll be at the hearing. That will be full of, just like last year, if anyone watched that happen, a bunch of definitely very tough men carrying lots of guns, because that's how you prove you're tough. That was not appropriate, but I'm really frustrated with this legislation. In any case, that's where we're at with freedom from violence. And we'll let you know how the hearing goes. We've got fact sheets and all of that. And then we're just going to move right in to definitely another bipartisan issue, which is to say reproductive healthcare and reproductive rights. And for this, I'm going to first turn it over to Scout to talk about the abortion bans that we have seen finally drop in the legislature.
Yes, thank you so much, Erin. So yeah, as Erin mentioned, I'm going to talk about both LB 606 and LB 626 that Senator Albright and co-sponsors did drop on Tuesday after announcing they were going to drop something the week before. So first, let's start with LB 626. This is an extreme abortion ban that bans abortion essentially 2 weeks after a missed period, before most people even know that they're pregnant. And the bottom line is that this bill is mandating that people who can't travel out of state or access care in other ways are going to be forced to carry pregnancies against their will. This bill does attempt to provide exceptions for different scenarios, including rape, incest, ectopic pregnancies, management of miscarriages, and IVF. But what I cannot stress enough is that, like all abortion bans that we see, there are so many open questions and potential scenarios that will not and never could be addressed or covered by a bill, despite these efforts to include these so-called exceptions. So just as an example from 626, this bill includes unclear language about abortion for medical emergencies only when there's a risk of immediate death or impairment of a major bodily function. And we all know that a reasonable physician practicing under the medical standard of care would never dream of waiting to intervene until the point of some imminent risk of death to provide that care. So, I mean, in that way, just in that one provision alone, that's just an example. This bill overrides physicians' professional medical judgment by requiring them to act in ways that violate their, the medical standard of care under which they were taught, and thank goodness under which they practice under. And I think that, we've seen this kind of scenario play out in other states where people are forced to go home and wait till their condition deteriorates to access care, which obviously can have short-term and long-term implications to that individual. But I think the bottom line that I really want to make clear on LB 626 is, number one, this is extreme. This is dangerous. And number three, all these the exceptions, like exceptions we see in all these bills, don't make this abortion ban any more okay. Our coalition partners will always have the strongest opposition to any piece of legislation that takes medical decisions out of the hands of Nebraskans and their doctors and puts them into the hands of politicians. And so, along with 626, Senator Albright also brought LB 606, which provides financial incentives for private donations to what are sometimes known as crisis pregnancy centers, which are anti-abortion facilities that disguise themselves as medical providers. Last spring, the ACLU published a report about these centers, specifically detailing their advertising practices. And the bottom line is that these facilities regularly lie to people who visit them. They provide false information. And we even heard from one individual who was told she was a full month farther along in her pregnancy to prevent her from making a decision that was best for her. So I think that with 606, it's important to remember also that this financial incentive is for people who donate to these fake anti-abortion clinics, not for people who visit them or are in need of assistance or care. And then I did also want to touch on a few constitutional amendments that have been brought. LB 18, 19, and 20. What they do is attempt to enshrine the right to abortion and reproductive freedom into our state constitution via a vote of the people in various ways. And so this is being done because courts have held that the Nebraska state constitution does not contain a broader right to privacy than the federal constitution that would include abortion, as has been found in several other states. And so these are efforts to enshrine that right to privacy, which would include access to abortion within our state constitution. And, you know, these are important because these are actually what is in line with what we know that the majority of Nebraskans want, which is freedom and autonomy to make their own decisions about medical care. So I did also want to highlight those constitutional amendments, and I will turn it back to Erin now.
Scout, you're so smart. So happy to have you on this team.
Thank you. I'm just gonna like record that and just play it around wherever I go.
You just call me anytime, I'll tell you. Anybody on this call who needs some affirmation, you just call me.
Thank you.
So just wanted to put that out there. Since everything is miserable, you should know that you're very smart. Another brilliant human, someone I love hanging out in the rotunda with. I'm going to move this over to Adele from Planned Parenthood to talk about the impacts to patient care of abortion bans and, you know, probably what we would anticipate this, you know, the state of abortion care and patient access looking like if this should pass. So Adele.
Thank you, Erin. And I will say, I reiterate that Scout did a great job of laying out the policy impacts of all of these different bills. So thank you, Scout. I'm going to talk a little bit more specifically about what the impact of this abortion ban or any abortion ban would have on Planned Parenthood's patients that we serve. So just right at the top, even though abortion is legal in Nebraska, there's already a lot of regulations on abortion. So we're already seeing negative impacts and barriers to abortion care, even in our current environment. If LB 626 were to pass, the impacts on our patients would be absolutely devastating. Any abortion ban, no matter what it looks like, what exceptions are in it, any further restriction denies Nebraskans from making deeply personal decisions about themselves and their families, their lives, their bodies, their futures. Any abortion ban comes between a patient and their doctor, and it ties the hands of doctors who are providing care to pregnant people, just like Scout talked about some of these exceptions. So that's obviously why we need to speak up and say that no ban and no compromise and no exception is acceptable. The language in 626 specifically bans abortion around 2 weeks after a missed period. And like Scout was saying, that's before most people even know that they're pregnant. So no matter how the proponents of the bill try to spin it, this bill is just a near total abortion ban. And we saw what the impacts of a 6-week ban are like when it was first passed in Texas just a couple of years ago, before Roe fell. The impacts were immediate and they were devastating for Texans. We saw folks having to travel hundreds of miles in order to access care, the financial burden, the travel burden, the childcare burden, and that was the folks who had the ability to travel. The folks who didn't have that ability, many of those folks had to give birth against their will. So that's the stakes that we're looking at with a 6-week ban. I'll also note that since Roe was overturned last summer, Planned Parenthood here in Nebraska has seen many, many more patients traveling into our health centers from out of state. So people from Texas, from Oklahoma, from other states throughout the South and Midwest that have banned abortion. So it's obviously devastating for Nebraskans if something like this passes, but it's also devastating for the entire country that is relying on the limited number of providers who are still left in the abortion care ecosystem to be able to provide care to folks who need it. Another bill that I would like to talk a little bit about is LB 810, and that's introduced by Senator Merman. This bill would allow medical providers to essentially deny services based on their personal beliefs. So that's a huge concern for a lot of reasons. One of those is that it would shield medical providers who refuse to provide essential reproductive health care, things that we all care about. But it also applies way more broadly than that to any form of health care. So as an example, if someone came into an ER wearing a MAGA hat and they needed a blood transfusion, they could be denied by a provider based on their personal beliefs. So there's a number of just different scenarios in which it doesn't make sense to be providing that kind of shield to providers to deny access to essential care. And doctors and medical associations aren't even asking for this bill. It's unnecessary, it's harmful, and it goes against the ethical standards that doctors and medical professionals hold. So it's a really harmful bill, and I would encourage folks to take action against that one as well. I'm good.
You are so smart too, Adele, and I'm happy to be in this work with you. Katie, you're also very smart. I forgot. Just trying to bring a little levity. There's a lot of bills too that touch on portions of this. So like LB 810 is really the most like extreme sort of complete example. There are also other bills by Kathleen Kauth that touch licensure and not losing your license based on expressing your personal beliefs and that kind of thing. So we'll make sure that we have a comprehensive list for everyone. Again, just this PowerPoint was getting very out of control as I was doing it with the list. So we'll make sure everyone has a list. There's a couple positive bills. If anybody would like to talk about those, I'm happy to as well. But not everything is bad. Actually, can you go back one slide? Sorry. Thanks. Appreciate it. Couple good bills. LB 333 by Senator Danielle Conrad would require a state plan amendment so that family planning services are covered under Medicaid. Am I right about that, Katie? Did I get that right? You're the Medicaid expert. Okay. LB 391 by Jen Day would provide criminal and civil immunity for pregnancy outcomes. So again, this is just another like backstop. If we're talking about abortion bans and we're saying that we care about these things, then let's make sure that we have it enshrined in statute that people whose pregnancies are not carried to term are not investigated and subject to criminal and civil investigations and penalties. And Scout, since you're the legal expert, did I describe that correctly?
Yes, I think the only thing is that it's protecting against prosecution, not necessarily investigation.
Right. Well, that's good. Then they can still investigate you. But oh Lordy. And LB 581, because our partners at IB Black Girl could not join us, I wanted to flag this as well. This would create a doula pilot program in corrections, an extension of Senator Michaela Cavanaugh's work. She introduced a bill a few years ago that said that you couldn't be shackled while giving birth. Basic stuff here. So this is just expanding access to the reproductive health care that people choose when they are pregnant in corrections. And so that's a great bill, great thing to support. And we'll make sure that everybody knows when those are coming up as well. All right. Next, wait, you know what? First, what I'm gonna do, I'm just gonna switch it up a little bit. Sorry to my team who's like, there's a script. We were supposed to follow things. I'm gonna open it up to some questions. So please feel particularly about reproductive rights. I know this is a really scary, and if you're like me, sort of full of rage time. So we have a host of experts here who are happy to answer any questions. And I know there's one in particular from Cindy here in the chat. If anyone has insight onto this about, and Cindy, I'm just going to paraphrase, last session with 933, they limited testimony. I mean, that's a huge problem generally, just because people drove all the way there and wanted their voice heard. And I'm not certain it's fair to do that. But that there's word that this committee, this bill would also probably have a time limit. I just want to flag for everyone, this bill has already been referenced to Health and Human Services, not Judiciary this time around. So if anyone has any thoughts on the panel about, how do we, folks who want to go testify, should they still go testify? Is it worth it?
So I can take that just to start. Absolutely, one of the #1 things that you can do to make your voice heard on one of these issues and get on the legislative record permanently in perpetuity is to testify at a hearing. And I know that that is a big commitment to ask of folks, and that it's not going to be possible for everyone. As advocates and organizations, we're going to try to make it as easy as possible for folks to be able to make that happen. So if that's something that people are interested in and they need any kind of support to make that happen, please let us know. But additionally, there's other ways to make your voice heard as well. At any point in time, you can email your own senator, you can email all of the senators, including the senators on the HHS committee. You can also put an online comment on the legislature's website that is available as soon as a bill is scheduled for a hearing, I believe, that you can put in a comment. Yep, Jill just confirmed that. So I absolutely encourage folks to do that. Again, that's something where at the end of a legislative hearing, the chair of the committee will say, we received this many in support and this many in opposition online. That's, a number that's going to be in the record for perpetuity. So that's really important as well. Even if there's other times you can show up at the Capitol or set a meeting with your senator, that's incredibly impactful as well. So whenever it works for your schedule, even if it's not on the hearing day, that's super important as well.
I think that's absolutely true, Adele. There's lots of ways to get involved. It's good to be at a hearing, and we also know that there will be a lot happening that day at that hearing. So definitely want to encourage folks to email their senator, call their senator, try and set a meeting. It's very hard for, I think, senators to escape the consequences when you're sitting face to face right in front of them, telling them why this matters to you. And if you are planning to come to the Capitol for any other day, one of us is always there and can help you figure out that process of sending in a note to your senator so that you can talk about a bill or finding their office or that kind of thing. So all of that support, we are also more than happy to provide. I know on this slide, I had also posted a few parents' bills of rights, bills that are bad. We've seen a slew of them, I think, this session. I posted them here because one of our other tenants, is sexual literacy. And we saw a big fight about people learning about their bodies and why kids shouldn't learn about their bodies with the State Board of Ed and around comprehensive health education. So I don't know if there's a question, does LB 71, which is from Senator Sanders, limit content taught in health classes or what healthcare can be provided in schools or both? It doesn't limit what healthcare can be provided, but it does limit access to all content, or allows parents to decide what content their kids are seeing in schools. I don't know if anyone else has read through that bill or has thoughts, but I put in health content here because of our focus on sexual literacy. But it really is anything that a parent might disagree with that's being taught in their schools. It provides them access to all curriculum materials, anything that's being taught in a classroom, any training that's being given to teachers, administration, or staff around any issues at all, and allows them to pull their kids from that training. And I just flagged it because I think it's a very slippery slope to parents deciding what can actually be taught in schools if their feelings are hurt by it. All right. Well, I think I covered that one. No one's told me I'm smart yet. I'm just kidding. Another question. What's the best timing if a faith group is planning a day of action at the unicameral on reproductive rights? Katie, do you want to talk a little bit, and then we can open up to the panel, but just maybe just touch on how quickly this session is moving?
Me?
Yeah.
Yeah, it's moving fast. It's moving slow, but it's moving fast. I think anytime, honestly, between now and day 90. And I don't mean to sound, glib about it, but I think that like anytime people want to show up and do anything, I think it's good. We won't know the hearing for a lot of these bills until a week before the hearing date is set. So I think that if you have a group of folks that want to come down and do a rally, do a press conference, do any kind of show of support, sitting in the balcony, talking to senators, this is going to be the issue, one of the issues, if not the issue, that the legislature is going to be focused on. And so I think any time between now and when the bill is where it ends up is a good time. And there's folks on this call that can help set that up or point you in the directions of how to set up something in the rotunda, or what the rules are around different kinds of actions in the Capitol. So between one of our groups, we're definitely there to walk people through that. And Erin, can I talk on the postpartum really fast too?
Yeah, absolutely. That's not on the slide, but it's in our bigger agenda. So yeah, please do talk about postpartum.
Yeah,
sure.
So it's a really exciting bill to have, kind of to take up a program in Medicaid that will help a lot of people. The federal government made the option to take postpartum coverage of Medicaid permanent. So it's something that states can do in perpetuity now for forever. So we see a growing number of states extending their postpartum coverage in Medicaid. It's been a very popular topic across the country. What we have right now in statute is that if you are pregnant and you are on Medicaid, you only have postpartum coverage for 60 days after birth, which I haven't given birth, but from all of those who I know who have, that's not nearly enough time to receive care after you have a baby. And so this would allow folks to stay on Medicaid up to 12 months postpartum. So they would still get services up to a year after giving birth, which is a lot better of an approach. Senator Wishart has the bill. It does have a really extensive bipartisan co-signer list, and it is growing every day. There are new senators adding their name to it, which is really, really exciting. And so I'm hopeful that this bill has a real chance at passing this year and we can put this program into place.
This is one of those fun bills where if you look at not only like the co-sponsors, but the organizations who are in coalition working on it, you're like, I feel like you all don't usually get along, but we all get along on this issue. So it's just, I think it's got a good chance of passing. And Senator Wishart has been very clear, that she cares about this bill, she cares about this issue. And if folks are going to be talking about limiting reproductive rights, then we need to be ideologically consistent and make sure that pregnant people are being taken care of in this state. So it's kind of an interesting, just some inside baseball of like interesting sort of dynamic of somewhat of using this bill actually being used to like hold people to account. If you're going to say one thing, you better actually do it. Anyway, these are all my philosophical ideas about this. So there's no other questions that I see, so maybe we will move on to the next more slides. I mean, the next slide to talk about more legislation. I was gonna say what fresh hell awaits, because there's some bad stuff on here too. So just some more bills that we wanted to highlight. Again, we have a much fuller list. But just right out of the gate, LB 56 by Senator McKinney requires that any sort of public facility have diaper changing accommodations in both the women's and men's bathroom. If you've ever, sent your male partner or someone out into the world with a child and they can't negotiate where to change the child, like on a trip from Omaha to Chicago that my husband took, and he's like, I don't know what I'm going to do. This would solve that problem, because as it turns out, it is not just women who are responsible for childcare and for diapers. Basic thing. LB 169, 487, and 670 are all from Senator Hunt. That would prohibit discrimination on the basis of sexual orientation and gender identity in various places. So cities and municipalities, schools, any school receiving state funding and employment. And then LB 179 by Senator John Frederickson would prohibit conversion therapy. So if you've paid attention to these issues, those have all mostly been introduced in the past, and we're bringing them back because they're important. Again, a much fuller list, but this is where we're at right now. In terms of some really, really terrible legislation that just by virtue of their existence are going to cause harm in Nebraska communities, regardless of, even if they don't have a chance of passing, which that we can't say that for sure. It's going to take all of us to make sure that these don't pass. Just that they are on paper, on record, that they are at all going to be discussed in the news or anything like that is going to cause harm. So LB 371 by Senator Merman would prohibit minors under the age of 19 at, I put this in quotes, drag shows, because the definition is so vague that, like, I went to an all-girls high school and we had, plays where we played all the characters. That would be considered a drag show. Several Shakespeare plays, really anything where you're wearing clothes that don't match what I assume Senator Merman believes is matching your biological sex at birth, would be considered a drag show if you're entertaining. And I'm very entertaining, so this could be any space I'm in, I think. This is how I've read the bill. It's really weird being on Zoom. I can't tell if people think that's funny or if they're like, we'll just assume people think it's funny. LB 441, thank you. Wanted to flag from Joni Albright. It just applies the obscenity statutes to college level institutions, which is not great. And LB 574 has been in the news a lot recently. This would ban gender affirming care for minors. I didn't want to put the name of the bill on here to give it any sort of legitimacy at all. But it's an incredibly destructive bill. It's just, honestly disgusting that this is even going to be a conversation in Nebraska to take, to debate whether or not I can't even. Anyway, we're gonna drop some stuff from the Trevor Project in the chat, and I would just encourage everybody. I need you to understand that, like, we do not have the time. We do not have any sort of this is not a regular session where we can say, well, someone else will email their senator, or this doesn't impact me. This impacts all of us if you care about Nebraskans and if you care about these communities. So you need to immediately email, call your senator, tell them that you oppose LB 574, and just every single one of the co-sponsors, all 22 of them, should be waking up in the cold sweat of guilt every night because of your email. So that's my call to action for you. And we'll make sure that we put out more information about organizing around this and making sure that we're providing safe spaces for people in these communities who are harmed just by the fact that this is out in the world. LB 575 would limit participation in sports at schools and bathrooms. She calls it protecting sports and spaces on the basis of biological sex. Now, the narrative around this is that this protects women in sports. So we will be coming with a laundry list of things that you could actually do to protect women instead of whatever nonsense this is. And we would encourage you to contact your senators and say there is no reason for these bills. They don't solve a problem. The problem doesn't exist. And that is just harmful and not who we are as Nebraskans. So I got off on a tirade, but it's Friday and these things disgust me that we even have to talk about this and that these communities even have to deal with this. So I will stop there. If any other panelists would like to weigh in on any of these bills, absolutely feel free. Otherwise, we can.
I mean, one thing that I would just say is, just personally, it seems to me like the same kinds of restrictions that we see on reproductive care and abortion are ideologically related to any other restrictions we see on people's bodily autonomy when it comes to trans people having the right to exist and be free. So I think we have to see these fights as totally interconnected.
That's 100% true. And Senator Conrad, if anyone's been watching the legislature, has been making these points from the floor, and so as well as Senator Hunt, that all of this is connected. All of these things, all of these bad bills intended to take away people's rights, intended to keep them out of the legislative process, intended to keep them economically insecure and in poverty. Like, all of those things are connected. And we do need, if we care about one issue, we care about the other ones. And I know that feels really overwhelming. And the next, my gosh, we're on day 12. So the next 78 days, legislative days, are going to be brutal. And we're going to win. We're going to defeat these bad bills. And we're only going to be able to do it if everyone is engaged. We don't have time. Someone else isn't going to do it for you. This is it. Like, this is the line. Yeah, I just ended real heavy. But it's incredibly heavy. We're coming up on 1, and I want to be respectful of everyone's time. So here's some options for taking action. We will follow up with everybody who joined this call with the slides and with this recording, as well as bill numbers and lists and anything else. Please make sure you're connected to all of our organizations and IB Black Girl, who could not join us today, and Nebraskans for Abortion Access, to make sure that you're getting updates on these issues. Any closing thoughts for our panelists? I'm putting you on the spot because I didn't tell you that this was coming.
No, I agree with showing up and making phone calls and writing emails. I used to work for a state senator, and they don't get as many of those as you think. And so 1 or 2 calls from a district on a bill can make a huge difference sometimes. So nothing you ever do to get in contact with your elected official is wrong. There's no wrong way. There's no wrong door. Get to know their staff on the phone, and just, know that they work for you. And so reaching out to them is really, really important, and will be on a lot of these issues this session.
And I think just adding to that, knowing that we are in the majority, and the majority of Nebraskans don't want to see abortion access pushed farther out of reach. They don't want to see these harmful anti-trans bills. And so remembering that, and remembering that the makeup of the legislature is not representative of who we are as a state and what we care about, I think that helps as well.
Well, all right. That was a good reminder, Scout. And yes, Katie, exactly like you said, there is no, even if your senator is vehemently against what you're about to tell them, it doesn't matter. They need to hear about it. That's your right as a citizen, and that's their job as a senator. So send all the emails, put an email, a calendar alert to remind you to send emails, do all of that. And we'll get through this together, and we'll come on the other side better than ever. So thank you to everyone for joining, to our brilliant panelists. So happy to be here with you. And why don't you take everyone who joined this call, take the afternoon to email your senator immediately. All right. Thanks all.